website. It lists all the requirements and has then posted the update that was announced yesterday about when and how we're opening our borders. And I can see this Bali has just opened, has changed its requirements as of 8th of March with this, so fully vaccinated, negative test before arrival, a further test on arrival, and then remaining in your hotel until you return waiting for that result. And if it's negative, you can then carry on with your holiday. So all countries are now grappling with finding the right system that works best for them. How do we find out what the risk of COVID is at a given destination? And probably the simplest and easiest website to go to is the USA CDC site. And they have this map, and you've got those bright red coloured countries which are considered very high risk at the moment, through to orange. The darker orange is high risk, the lighter orange moderate risk, and then the yellow low risk. And this is based on virus transmission rates current, and it's updated very, very frequently, which is great because New Zealand for a very long time we were in the low risk until we had our Omicron outbreak, which we're in the middle of the surge at the moment. So we're currently very high risk. So it's transmission rates at country, plus they've taken into consideration healthcare capacity and public health infrastructure at the destination, which is really good because it gives you some idea about the reliability of those figures, but also if you were to get COVID, how easy will it be to access medical care in country? Is this traveller at increased risk of severe disease if they are infected? If I'm going to advise this traveller, I need to know this. And all we really need to know is read up about the risk factors for death and for developing severe COVID disease. There's lots of papers out there now. We're starting to get a much stronger picture as to who is at higher risk, and certainly it's the unvaccinated, which I haven't put onto this slide, but assuming all our travellers are going to be vaccinated, it's certainly older age, male, people who are obese, people with diabetes, hypertension and other cardiovascular disease, respiratory disease, anyone with cancer or immunocompromised, and of course pregnant women as well. So once I've got all that information together and I can give my travellers some feel for are they at particularly high risk or low risk, they've sorted out what their entry requirements are, their vaccination requirements, all their documentation. They know they're going to a higher or a lower risk country, and their individual risk based on their risk factors. So what advice am I now going to give? What COVID-specific advice am I going to give everybody? And I think the most important thing is get vaccinated. Now, nearly all of these people will have to be vaccinated to be able to enter any other country. But most importantly, I think now we need to be advising people to be boosted. If it's not an entry requirement to have received a booster, we should be recommending people get boosted depending on which vaccine you're using. For us in New Zealand, we're using Pfizer as our main vaccine, and the messenger RNA vaccine, which is primary series is 2 doses, 21 days apart, although it can be given longer, but at the moment that's the minimum time. And at the moment we've moved our boosters down to 3 months, minimum 3 months, but it can be given at any time past after your primary series. So that getting people boosted before they're travelling, if it's more than some months since they've had their primary series, is really, really important to boost their immunity before they travel. We need to give good advice about masks, how to wear them, how to put them on properly, have enough for the entire journey, when to remove them and how to dispose of them. Hand hygiene still very important in infection disease control of all infections. So making sure reminding people how important it is to be washing and drying their hands, and making sure they're taking plenty of hand sanitizer and things with them as well. Maintain practicing physical distancing, really important. The importance of seeking medical care if you are unwell, and really, really important that people ensure that the insurance policy they're taking out covers them to the extent it can for COVID as well. And lots of travel insurance policies have now got COVID add-on options, and really important that people look at those and look at what it does cover and what it doesn't cover. And so what you may have to cover yourself if you do find yourself stranded somewhere because borders have suddenly shut again. Again, the IATA site has got some fantastic resources for travellers. You can direct your travellers to these and they can have a look through them. They've got some lovely, simple information about what you can do to reduce your social interaction while you are travelling, from before, during flight, and all the check-in process. So again, refer your travellers there. A reminder that yes, most airlines wearing masks is mandatory, and if it's not mandatory, then people certainly should be doing it anyway. The USA CDC has got some nice infographics and information about social distancing, wearing masks, and hand washing as well. And if you as practitioners want to find access some resources, again, the IATA website's got great resources about air travel and the thinking behind their recommendations and the like. So take the time to have a look through those if you're very interested. So in summary, people already have started travelling internationally again, and will increase as restrictions continue to ease and as confidence continues to build. The principles of the pre-travel consultation remember the same. It's just that COVID-19 now has been just another travel-related health risk that we need to advise on. Pre-travel and on arrival COVID-19 screening requirements and vaccination requirements are very variable, highly variable, and they are changing rapidly. So as travel medicine practitioners, we need to keep up to date with those things, and we need to be able to adapt. Now, for some, it's not going to be practical for us to sit down with our travellers and go through all those requirements on their itinerary, but it's about giving them advice about where to go so that they can do a lot of the work for them, and then you can help facilitate those requirements. So thank you very much. Once again, I'm so sorry I can't be with you in real time. If there are any burning questions that you wanted answered, I'm very happy to respond to those by email. So please just let the course organisers know, and good luck for the rest of your wonderful meeting, and I'm sure it's going to be very worthwhile. Thank you very much. Goodbye from New Zealand. Bye.
Well, thank you very much, Jenny. So I think there is a lot of overlap message between what has been said by Prof. Leggett and also from Jenny's presentation. So Jenny's perspective offers some practical suggestion from a practitioner perspective, but I think the approach are very similar to what has been suggested by Prof. Leggett, looking at as a continuum approach rather than a singular approach. And the other key points that I really like to pointing out from Jenny's presentation is there is a need for harmonized and also coordinated response and travel requirements across the country. So if we about to resume the international travel again. So yeah, without further ado, so we have almost 30 minutes for question and answer. So I would like to invite all the participants. If you have questions or comments, or perhaps share your experience directly or indirectly through a chat box, feel free to do so. Anyone would like to raise questions? So while waiting for the participant, Peter, so there is one thing that I think require further discussion. Do you think the requirement for the risk assessment pre-travel will create a kind of inequity for people who have comorbidity, for example, or those who are in high risk for mortality from COVID? So this will restrict them from international travel, or what is your take on that, Peter?
Yes, firstly, I think that was a great presentation from Jenny. I think it was very good summary from the practitioner's point of view at the moment. The risk assessment is incredibly important, and pre-existing conditions are even more important to evaluate than ever before, because there are a lot of diseases out there for travellers that could exacerbate their pre-existing conditions. But now COVID, of course, we're adding to that list. So the quantification of that risk is hard when the COVID risk is different in different countries, and I think Jenny did allude to that. So and I think throughout this response to the pandemic, the responses from different countries have been different as well. But that just complicates a little bit, I think, the pre-travel health consultation, because you haven't got one message fits all. So you've got to detail the information by country, and people may be traveling through several countries before they get to their destination, and of course it can impact on the advice that you receive. So I think what's happened in pre-travel health consultations is that you start off with COVID and try and get that sorted, because that's the one that's really difficult to pin down. Like there's no one website that'll tell you exactly what to say to people traveling around the world. So you have to do that research yourself. And I have to say the traveler has to take some responsibility as well, because there are requirements for individual travelers by country. Even returning to Australia, there's a declaration that you need to make online 72 hours before you go back. And my observation was that over 60% of people weren't aware of it. So you need to do the research on your own travel, even back to your own country, because this can hold you up, if nothing else, at immigration, where you've got to go through all this with the immigration officers. So I do feel sorry for immigration officers who need to go through all this. But I have noticed that they're taking this very seriously when you're passing through overseas destinations. So if you don't have the paperwork, you're unlikely to be allowed onto that next flight. So I think there are not too many things in travel medicine that stop you going to a destination. Maybe yellow fever vaccination might be one. So to me, it feels as if COVID-19 might need to be managed by the World Health Organization at some point as one of those required vaccines for different destinations. I'm hoping that COVID will be wiped out one day, but until it is, we do need to take seriously the requirements for COVID vaccination, PCR testing, all that type of stuff that's now required. But some consistency would be good, and maybe this is a role WHO could play as well, and tried to play early on in the pandemic, but there was just too much politics involved, unfortunately. So I think this is a time to come together to make requirements consistent across all the different countries around the world. But great presentation by Jenny, and certainly applaud her for that nice, succinct presentation for pre-travel health consultations.
Yep. Thank you, Peter. So as you can see, we have a couple of questions popping up in the chat box. So let me read one question from Kurnia. For people unable to vaccinated with the COVID-19 vaccine, is a later medical report signed by the GP is accepted for travel requirement entering Australia? Is there any validity period of the letter? Is that possible if they have medical exam in Australia and get vaccinated there? So do you want to respond to that, Peter?
Yeah, so this is, I guess, another example of where different countries have different requirements. So as Jenny mentioned, some countries require 2 vaccines, others require 3. And that was certainly my experience going into Europe. So Switzerland, which was my final international destination, required only 2 vaccinations. but Germany, when I was visiting there, required 3. So 2 vaccinations, primary course plus a booster. So this is where I'm really saying that you have to research the destination, about the requirements for that destination, and it's a shared responsibility, I believe, between the travel health advisor and the traveller, because ultimately the traveller is the one that has to present this information to the officials. So some of that advice can be given early, but through the travel health person, but really it's up to the traveller to take some responsibility for that. And it's difficult because there's so many things you need to think about when you're traveling. To think about all the requirements for COVID is sometimes difficult. Um, yeah, so so researching individual destinations, including Australia or Thailand or Europe or whatever, I think you just have to find out what their requirements are, and be prepared to be flexible. So if you need to get a third vaccine, then you need to get a third vaccine to enter Germany. But or get a PCR test, or do get the rapid antigen test, whatever is required.
Mm. So, do you think there is a possibility in the future that those who are not vaccinated won't get the luxurious of international travel, Peter?
I think it will happen. I think the vaccine rates the COVID rates are so high in different countries around the world. You saw from the CDC map that Jenny presented, was that most parts of the world are red. So for your own personal safety perspective, I think if you're not vaccinated, then you've got nothing stopping that COVID vaccination. So you can practice good hand hygiene, all those sort of things, wear a mask, but ultimately the vaccine does have some role in preventing COVID. So I think it would be a very brave person to travel without a COVID vaccine at the moment, but situation can change. I mean, many diseases, as we saw earlier in my presentation, are not that common, and you can give vaccines for those that are a little bit more common. And I think the COVID vaccine will take that status, a little bit like influenza, I think, had been sort of the most common vaccine preventable disease previously. It's probably going to be COVID for the foreseeable future.
Yep. This is a really a good follow-up question from your previous point, Peter. So, question from Rasmika Devi. So, asking, in your opinion about traveling policies in the near future, do you think there will be a prominent international regulation or policy of international traveling, which will or may change the way we travel abroad?
Yes, I think an international agency will be involved. Some have been involved already to try to modify this, like IATA. But I think it's going to need somebody like World Health Organization to start to align the different requirements in different countries. And what we're seeing is that countries are aligning themselves. So they're looking at what other people do, and they will modify their requirements. And I think at some point there will need to be a World Health Assembly declaration, I guess, on what is required for travel in the post-COVID era. And this is where COVID is just another disease in the community. But at the moment, because the COVID rate is so high in different countries are taking their own responsibility to detail those requirements. But yes, I think the time will come at some point where an international regulation may come in.
Yep, I think we still need to watch the space for that one to come. So another question from Lika, Peter. So it's about corporate travel and other types of travelers. So the question is, are there any different in their behaviors? I assume it's related to COVID-19 risk, including preventive behavior or risk-taking activities during traveling.
In general, I find with corporate travelers, if you have a good employer, is that they will have great programs to help educate you on the risks of travel and COVID, particularly as if that person gets COVID, then of course there are other concerns about the responsibility that employers take in the workplace, and those sort of things are usually governed by workplace health and safety regulations in different countries, so they can be prosecuted. People can go to jail if they don't provide good advice to their corporate travelers. But really, the same outcome, and you do need to follow the advice of the different countries where they're going to be visiting, and obviously take that advice. And part of that is up to the individual employee, of course. But you know, part of it is also up to the employer to emphasize the requirements for that travel.
Yeah. There is one more question. No, two. We have two more here, Peter. So
Yep.
one is from Lombok, which is from Faculty of Medicine, University of Mataram.
Yes.
This one from Arafah. So the question is that regarding the traveling requirements of vaccination, do the countries that require this have already got the system integration agreement, the types of vaccines received, and ensuring the validity of vaccine passport or documents? I'm not quite sure.
So
Yeah.
I think I understand that, but
Okay. Go for it, Peter.
there has been some work done already with between different countries to harmonize what is required for travelers. So the documentation they have may have a code, you know, what if we call those codes for scanning codes, so that information that comes up can be validated by different health officials. And that was certainly just in the example of my case going from Australia to Switzerland recently. The Swiss authorities had the capability of scanning documents that you had. And so if there is a barcode there, which is accepted internationally, and in Australia, at least, we've been trying to adopt some international standards around that type of, you know, immunisation documentation and so on, just to ensure that people know that that certificate is valid. and so it's as much about validity as it is about understanding the vaccine that you've been given. Because actually most countries are accepting the vaccines that are out there. There's a bit of variability, but actually most seem to be accepting the different vaccines that are out there. There was a little bit of problem initially with the AstraZeneca, but that seems to have been solved now for many countries at least. But it is a good question, and the more of this we can see, the international harmonisation of documentation, the easier it is going to be for travellers, so that they can pass seamlessly through those checkpoints. Because if they get passed through the secondary screening checkpoint for all this stuff, then of course they could be there for hours and miss flights and that type of thing.
Yeah, that's very true. So yeah, we have a couple more questions here, but I would like to invite my colleague from Udayana, Chitra Suchipta. Would you like to ask your question directly? Chitra?
I'm surprised I have to I have to get my question, but it's okay. Thank you, Dr.
Yeah, just go ahead, Chitra. Yeah.
Good afternoon, Professor Lagat, Peter, and Jenny.
Yes. Good afternoon, Chitra.
Hopefully you are healthy there.
I'm trying to be.
Actually, I just would like to ask basic question. Yeah, because I know that you both are expert in travel medicine. Here in Indayana, we have like confusion about travel medicine is what, who is the population at risk? Is it only tourists or can be other population at risk? Because here in Bali, we know that now we don't have a lot of tourists, international tourists, but there are domestic tourists also. So as an academician, for example, if we want to research about travel medicine, it is quite hard to get like sample, and it's really strict if it's only for tourists. I just would like to have insight from people that professor and academician that I really honored about this. So I hope you can give insight about this to us here in Udayana. Thank you.
Yeah,
Thank
no,
you,
it's
Dr. Suparto.
Thank you, Chitra. Yep.
yes.
Go ahead, Peter.
So thank you very much for that question, and I think this also sheds a bit of light on the research that the travel health community needs to undertake. So at the moment, we have individuals doing research in different places, and of course this can be done in Bali as well. We also have people that are contributing cases to international databases like GeoSentinel. So GeoSentinel is a global program that's supported by the Centers for Disease Control and Prevention to monitor diseases around the world. So, and I think this is quite useful because it's helped to identify a couple of outbreaks by showing that that travellers are coming back from a place where there was an outbreak. I think with COVID, it's affecting both domestic and international travel. And I think you saw the very extreme response taken in Australia recently, where individual states closed their borders to travellers from anywhere else, and this was because the COVID travellers domestic travellers can bring COVID to different states of Australia as much as international tourists could. Although I have to say, with international tourists, at least we might know that they're at a point in time might be negative with a test, or we can check their COVID vaccination status. But really, I think what states have found is that you just can't close borders because the COVID is going to get through anyway. So all states of Australia have now opened to domestic tourists. International tourists are obviously regulated through various ports, and the main port of entry into Australia at the moment is Sydney. But I'm sure other states will open their international airports in time as well. Brisbane's has a little bit of travel with Emirates, for example. But yes, it's a good question, and we do need to know what we're dealing with travellers that are coming into Bali or coming or leaving Bali. So obviously there may be conditions in Bali that those travellers can take back to their home country, and it's important that the travel health practitioners can educate travellers to Bali about those potential risks, but we also need to know what the risks are of travellers entering in addition to COVID, because there are other things that those travellers might bring in as well. But very few diseases are regulated internationally at the moment. The only one is yellow fever, maybe meningococcal disease for people going to the Hajj, but really there's very little regulation of travellers and vaccinations and that type of thing at the moment. So there's no requirement for a traveller to be vaccinated against anything, unless they're going into a yellow fever area or going to the Hajj. So I think we have to use our understanding of travel medicine to, I guess, push an agenda nationally and internationally about promoting healthy travel. It's a very important aspect of what we do. Because travellers can impact greatly on the destination, as we saw with COVID. So it just didn't magically appear around the world. It was brought in by different travellers around the world. So definitely a need for research and a better understanding of what travellers are travelling with, and I think Sentinel or GeoSentinel type programs can be useful as well in this respect.
Mm-hmm. I do have a follow-up question on that, Peter. So from your response, so what is actually the value? We know that the COVID already spread into the community, even in a destination or in a country of origin. So what do you think the value of mandatory quarantine, even for 3 days, for example, or providing a negative PCR test, for example? Peter, do you think this is a practice that need to be maintained if we agree that travel has to resume?
Well, if one is in a position of authority to advise immigration about this type of thing, I think it would be good. I think most of the decisions being made at the moment are at the political level.
Yeah.
So they're going for safety, so they don't want to increase the risk at all. But it's all about risk benefit. So if the benefit to the population is economic, but you're stopping people coming because of a regulation around COVID, then that can be quite serious. Like Bali will never get any more tourists if you keep up a certain regulation, for example. So So I think countries are determining their own requirements at the moment, which might include PCR testing, it might include rapid antigen testing, as long as they realise that that the test that they do is valid for that point in time. So a traveller could actually get COVID in and around that time period. So it could be a few days down the track, or it might be a week down the track. So I don't think we can come up with a regulation that'll solve everything with respect to COVID, because it's just something that can appear anytime during the incubation period of that that virus, as we see when people brought the virus in initially from different parts of the world. So I think you had a second part to that question, but I just can't remember what it was.
It's a mandatory quarantine. Some countries they have 3 days, and some people, some countries have 5 days, 7 days, and
yep. But again, the incubation period is what it is, you know. And so if you have 3 days, then you're decreasing the risk. If you have 7 days, you're decreasing the risk again. But if somebody can get COVID up to 14 days or even longer, then of course there remains a risk. So it's all about risk benefit, I think. And this is something that very learned people need to talk about around the table. Because while COVID continues to be a problem, then obviously it's going to be a high risk for that destination.
Yeah. Well, thank you, Peter. So we have a really interesting question here from Rena. So rather than reading this message, I would like to invite Rena to ask the question directly to Prof. Leggett.
Hi, thank you for the opportunity. Well, I'm Rena. I'm actually a dentistry student, but I did exchange in the University of Edinburgh last year, and I learned about contemporary issues in health and well-being, and did talk about travels and migrants and refugees' health in particular. Regarding your presentation, I think I have a question. To travel in the midst of pandemic, I personally think that it is already something that is tricky. There's abundance of prerequisites to be able to travel internationally, but rather in the context of current global situation with what's going on in Ukraine and Russia and unfortunate catastrophes, there are a lot of going on in this world. It sadly perpetuates number of refugees that must travel to save their lives. And in this case, they are travelers who are in the state of emergency. I feel like there are two ideas clashing here, whether to hold on those prerequisites to be fulfilled before accepting them, or to accept them first considering they are in a state of emergency. And I think this is something that is important to be talked about, because travel medicine is not only about health tourism, but also about people traveling all around the world. And in this case, refugees are the one who's traveling around the world. And without the pandemic itself, there are already numbers of pre-existing political sentiment in accepting refugees, right? And with those clashing ideas, which one do you think is more important, and how do you think this problem should be approached? Thank you.
Yeah, well, thank you very much for that question. The first thing I have to say is I'm not a migrant health expert, so I can just observe what's happening. So usually with migrations and emergencies, usually the numbers of migrants are overwhelming. So we're seeing that in the Ukraine at the moment, where I think 3 million people now have crossed the border. And of course, a few are even taking trips to Australia, I noticed over the last couple of weeks as well. So this is a significant issue, significant problem. And again, it's really going to be up to the people that deal with migrants to make decisions about what they accept or don't accept in relation to COVID, for example. But there might be other things that they need to think about as well with migrants. And I know that in Australia, when migrants come to Australia, they're given comprehensive testing for different types of conditions depending on where they come from, and often we do find those things. So it might be, you know, trypanosomiasis, or it might be leishmaniasis, it might be malaria, for example. So very important to know what things they've been traveling with, and may not be just COVID. But obviously at the moment, you know, where you've got countries that might be getting on top of COVID, and then they bring in migrants that may have a lot of COVID, then I can sympathise a bit with the border officials, I suppose, and how you manage that situation. But yes, it's something that really sits firmly with those managing the migrant populations into that country. So there is going to be a national responsibility, and there may be international responsibility as well, because there are different international migration groups, United Nations High Commission of Refugees, for example, and so on, different groups that are going to be involved with these migrant populations. So they're all going to need to come to terms with what the policy might be around accepting immigrants. But you're right, it could involve accepting them directly, so that they can get that management or treatment that they need, or it might be that they have to pass certain requirements before they enter the country. But as I said, the numbers of people coming in through international emergencies usually tend to be quite large. So managing that is very difficult. And again, sympathise with the border officials that need to deal with these things.
Yeah, yeah. So yeah, so again, I think it's really exactly what Jenny was saying earlier. So it's there is a need for coordination and harmonized approach from multiple agency really. So if we're dealing with migrants, for example, those who are dealing with migrants or asylum seekers need to sit at the same table and then create their own harmonized approach. So I think it's a really powerful message both from you and Jenny, so that there is a need for harmonized and coordinated approach for travel requirements for different purposes, including migrants, for example.
Yeah, it's a very interesting question.
Yeah.
And be interesting to have a migrant health person respond to that as well, because if you're in the field, you often realize what the problems are and what the challenges are.
Yeah, true. And the other question that I would like to ask you, Peter, so about the COVID insurance. So what is your take on COVID insurance, Peter?
Well, at the moment, the insurers, at least in Australia, are doing a great job because what they do is they analyse what the main destinations are and what their requirements are, and then put a statement in their insurance to cover that. So I have to say I've been impressed with insurers in Australia about ensuring that when you go to Thailand, for example, as a visitor or even as a transit person, that you have exactly the statement that they're looking for. So I greatly respect what they've done there, because with travel insurance often it's quite complicated, but they've got a clear passage in their main policy document that says that you're covered unlimited costs for COVID. So that covers any particular eventuality that might occur. And I was very pleased to see that when I got my insurance. But yes, something you need to think about, because unfortunately in Zurich, when I was there and checking all the paperwork, there was one poor lady there that had insurance only for $30,000. It didn't cover the $50,000 required for Thailand. So you can see that you can miss out if even if insurance is not harmonized.
Yep. So I think that's now it's an emerging. So you need to tick the COVID insurance boxes and pay a couple of extra dollars for the insurance. But I think it's worth it. So it's just for the security.
Well, you need it for just your general travel. So I've been amazed by the different surveys that have come through where up to half or more of travellers have not been taking out travel insurance. And it's just so risky, I think, because you're away from home, you're away from the base where the free treatment might be given, or the 30 baht program or whatever, to a country where you've got to pay for everything. And I have to say, in the US and Canada and countries like that, if you go to ICU or need a surgery done, it's very expensive. You would not be able to pay for it. You need to put up a credit card, but no one's credit card is going to be able to pay for those expenses. I don't think so. So travel insurance a must. You shouldn't travel without it, in fact.
Yep. Well, thank you very much, Peter. So I just received a text from the committee. So we're about to hit to 25 mark. So, and well, this is a really engaging discussion, Peter. I really enjoy that a lot. So even though travel medicine is not my area of interest, but I do learn a lot, and I can see the intersection between global health and health system with the travel medicine. So, and I think there is an opportunity moving forward for collaboration. And with that, and on that note, I would like to hand it over to the committee. And once again, let's give a round of applause for Peter for all the comments and also for the comprehensive explanation. Yep. Thank you, Peter, for all of the response and for the great
Hello,
presentation.
everybody. My name is Dr. Jenny Visser, and I'm so sorry.
Thank you, Peter. Very nice presentation. Thank you so much.
Thank you.
Silakan Cok dan Clifton.
Once again, we would like to thank Prof. Peter and Dr. Jenny for presenting the material.
Now, as our appreciation for your valuable contribution, we would like to present certificates to the speakers symbolically. For the committee who's in charge, please kindly hand over the certificate to the speakers.
To commemorate this event, we will have a documentation session. For the committee who's in charge, the time is yours.
We also thank the moderator of our first session, Dr. Inyoman Sutarse, Doctor of Medicine, Master of Public Health, Doctor of Philosophy, Fellows of Higher Education Academy.
Now, we would like to present the certificate to the moderator symbolically. For the committee who's in charge, please kindly hand over the certificate to the moderator. Thank you.
And to commemorate this event, we will have a documentation session. For the committee who's in charge, the time is yours.
Once again, we would like to thank the speaker and the moderators who have been willing to participate in our first session today.
We would like to announce that we will have a break session for 30 minutes until 12 p.m. East Indonesia time.
All participants may turn off the camera and the microphone feature, but please remain in the meeting room. All participants are required to be present 5 minutes before the break session ends. Thank you.
Ladies and gentlemen, the break session has now ended.
All participants are required to turn on the camera and turn the microphone off to maintain the conductivity of this event.
And now we will move on to the second session of today's seminar.
The next agenda is the presentation of the second material. Before that, we would like to recognize the moderator for the second session. To the committee who's in charge, please share the CV.
For the second moderator of today's seminar, we will have Dr. Made Agus Hendrayana, Doctor of Medicine, Master of Health. He has several education history, such as in 1997, he finished his bachelor degree in Udayana University, specifically in medical education and medical profession program. In 2008, he finished his master degree in Erlangga University, specifically in tropical medicine program. And lastly, in 2018, he finished his postgraduate degree in Udayana University, specifically in medical science program. For his non-degree education history, he went to University of Göttingen in Germany on 2009. He also went to Erasmus Medical Center in Rotterdam on 2013, and he also went to Burapha University in Thailand on 2018. There are several scientific fields that he is interested to, for example, microbiology, virology, tropical medicine, and travel medicine. He also has several experiences in organization, for example, being the secretary of ID Denpasar, being the vice president of ID Denpasar, and last but not least, being the secretary of BKFK Denpasar. So without further ado, please welcome Dr. Made Agus Hendrayana, Doctor of Medicine, Master of Health. The floor is yours.
Okay, thank you for the MC, Nadia and Clifton. Is my voice is clear? Yes? Yes. You hear my voice. Okay, good afternoon for all participants and for speakers and committee. Then the Honorable for the Dean of Medical Faculty of Udayana University. And for all participants, good afternoon. Okay, we continue today to the second session, and we have one speaker for this session. The speaker is Dr. Susilo Tama, and maybe I later introduce Dr. Susilo. This session, we will present the topic about travel medicine society's rules in destination. So this is interesting topics. Okay, this is an interesting topics because we are now in COVID-19 pandemic, and what about the travel society rules? So Dr. Susilo will give our presentation. Okay, the presentation is Dr. Susilo Utama. This can the committee share the CV of Dr. Susilo Utama? Yes, this is the CV of Dr. Susilo Utama. All participants can see it. His name is Dr. Imadi Susilo Utama, spesialis penyakit dalam, konsultan penyakit tropis infeksi Vinasim. For the education, Dr. Susilo has completed the medical education as a GP at 1994, and then he completed the internist specialist at 2004. And then he completed the consultant of tropical and infectious disease at 2011, and he completed the doctoral degree at 2020. He also worked at Sanglah Hospital, General Hospital of Sanglah, and then at Medical Faculty of Udayana University. Today at the present, Dr. Susilo Utama is also head of Indonesian Society of Travel Medicine for Bali Chapter, or we know at Perkedwi, Perhimpunan Kedokteran Wisata Indonesia. Beliau is the head of Bali Chapter. Okay, let's continue for the session. Before we start the presentation from Dr. Susilo, let me announce the rule of this session. First, the presentation is around 30 minutes, Dr. Cecilia, and then we give and second we give a discussion for around 20 minutes. And then for the all participants, if you have any questions, you can chat of the chat room. And please don't forget write your name and where are you from for institution or any else. Write your name and your institution. Or you can raise your hand at discussion session so I can see who wants to ask some question. Okay, I will continue to the session. Dr. Sila is ready. Yes, please, Dr. Susila, and Dr. Sila is already. And Dr. Sila, time is yours. Thank you.
Right. Thank you, Dr. Agus Hendrayana, my colleagues. Thanks to committee of the webinar from Faculty of Medicine, Udayana University, for opportunity to give or explain about the travel medicines. As we know, travel medicines in the last time so have opportunity in the pandemic era. So we need to learn more about travel medicines. And related to the society of the travel medicine, we will give learning, or maybe we can discuss about the travel medicine society role and destination. Our outline presentation, maybe next slide. The first we will tell about the travel medicine and travel health, followed by the travel medicine society, and the last we can learn about the travel medicine society's role and destination. Okay, next slide. Travel medicine is a challenge specialty that requires up-to-date knowledge on the global epidemiology of infectious and non-infectious health risk in traveler, that changing distribution of drug-resistant infection, and both international and local health regulation, and also immunization requirements. Travel medicine is an interdisciplinary specialty, concerned with the first, prevention of infectious disease during travel, the second, personal safety of the travels, and the last, how we can avoidance of environmental risk for travelers. Next. The practitioner in travel medicines should be skilled in performing a detailed risk assessment for each individual traveler in order to accurately evaluate traveler. Mostly, the practitioner must know about the pre-travel to make pre-travel assessment each individual until in itinerary and destination specific risks. Every traveler have the other specific risks, so we can identify it on pre-travel consultation. And also the practitioner must to give advice on the most appropriate intervention to promote health and prevent adverse health outcome during travel. So the primary goal in travel medicine is to keep travelers alive and healthy. We must keep the travelers always healthy and alive. Next slide. The travel medicine unique specialty that's interdisciplinary is part of the preventive medicines, but includes epidemiology of the disease, and the last, travel medicine also accommodates curative care and self-treatment. Like this picture, you can see that's the travel medicines, including in the epidemiology of the disease, how to prevent medicine, and And the last, how to accommodate curative care for the disease and traveler, or maybe give advice self-treatment for the traveler. Next. This is the slide, maybe the same with the Professor Legat before. Mr. Peter also explained this slide. That's the travel medicine is the continuum by pre-travel, during travel, and also post-travel. The visitors or traveler from pre-travel, we must make the assessment for the risk of the infection and the others. And during travel, we must observe and monitoring the possibility of the risk for traveler, not only the infection, on also the non-infectious disease. And until the traveler finishing the travel, we must also evaluate post-travel. Sometimes many travelers after travel or post-travel have many infectious or other problem post-travel. So the practitioner in travel medicine also identification of the disease post-traveler. Next slide. How in approach in travel medicines? Travel medicine as the new disciplines from the traditional disciplines, many science from tropical medicine, infectious disease, internal medicine, pediatric, geriatric, obstetric, and all of the traditional disciplines all of the traditional discipline that specific travel related by the epidemiology of the disease and the destination, how to prevention infection or the other problem in traveler, and also how to advise the self-treatment and treatment traveler with the problem of the disease. Next slide. Many like the travel medicine. What is the travel medicine? Travel health and health tourism are so different. Travel medicine focus only on the how to identification of risk infection or the disease, but in the health tourism, travel health more wider than travel medicine, until the travel health learn about the medical tourism and the others, but in health tourism more wider how to health population in destination of traveler. And we can focus not only in the travel medicine, but we all must learn about the travel health and also health tourism. Next slide. In the last time, the medical tourism, the developments of very increased. I hope the next, after the pandemic era, we have the more medical tourism in our country and in Bali. So the health tourisms include in the wellness care, not only the therapeutic treatment, also the wellness care. The client focus overall on the wellness promotion and maintenance, but in the therapeutic treatment, in the chronic condition for the optimizing health. And the medical tourism, so how to can make the treat the acute and chronic medical condition by with the tourism in the same times. And in the wellness care, there is a wellness promotion, many service for the wellness promotion, from relaxation, meditation, product, spa, yoga, and the others, weight management, and then in the complementary and alternative medicine, also in the medical tourism, like alternative therapy, homeopathy, acupuncture, and the others, and the conventional medicine for medical tourism, commonly in the surgery, cardiac surgery, dental, dialysis treatment, weight loss, surgery, and the others. The consumables for this wellness care by vitamin, natural herbal product, and the medical tourism by medication. The facilities for the wellness care in the spa, resort, hotel, but for the chronic condition in the clinics, therapeutic treatment, and medical tourism in hospital. Service provider in the wellness care therapeutic treatment by therapists and in the medical tourism must by the health professional for medical tourism. Next slide. How about the travel medicine in the pandemic era? The previous speaker and other hazard as undertaken in the past practice for each journey. The question before, how about the vaccination, how to prevent COVID-19 infection by swab, PCR, and the others. So I think will be changed depend on the pandemic situation condition. If the pandemic situation condition getting better and maybe we can suppress the cases, maybe will changes in the vaccination and also prepare for travel the other country. Disease management and infection control will be a new role in deal with COVID-19. That means in the travel medicine and the next, we must more concern and identification about the risk of COVID-19 for every traveler and also how to give medication or maybe isolation for the traveler if have the problem with the confirmed COVID-19. Then we may have rapid diagnostic COVID-19 personal kits maybe, and possible even early rapid therapy as a part of the traveler's medical bag. We know in the travel medicine, we know the traveler bag or kit traveler health, kit travel medicine. The next in the kit travel medicine also include the rapid diagnostic COVID-19 personal kits and medication for prevention the infection or maybe for treatment the infection. So training and educating traveler to their use will be part of the preparation. And then and pre-travel consultation, we must give consultation about how to prevent the COVID-19 and also maybe need isolation or maybe early identification of the symptoms COVID-19 infection and also treat with medication if confirmed infection. Next slide. Now we can discuss about the society of the travel medicine. Every country or every regional have the society of travel medicine. The International Society of Travel Medicine, the president of ISTM, Professor Legat, already give more learning about the travel medicine, that the International Society of Travel Medicine with the logo promoting healthy travel worldwide is the ISTM is committed to the promotion of healthy and safe travel. Next slide. Next slide. And then goal of the International Society of the Travel Medicine, many goals of the International Society of Travel Medicine. The first, promote travel health. And the second, develop the guidelines for the travel medicine practice. We hope the practitioner and travel medicine have guidelines how to treatment the infection, how to avoid the risk in the traveler and the others. And ISTM, International Society, educate healthcare professional, public health professional, and the travel industry, and provide a scientific focus for travel medicine, stimulate the professional advancement of travel medicine practice, also promote distribution and of rapid information exchange related to travel medicine issue, maybe many issue. The STM will be promote the rapid information. And the STM facilitate the international contact between practitioners of travel medicine, maybe by seminar of the travel medicine, international seminar, and the others, and promote development and evaluation of safe, effective, preventive, and curative intervention. Foster research in travel medicine include the promoting of international collaborative studies. Next slide. In the Asia Pacific, we know there is the Society of the Travel Medicine in Asia Pacific with the term the Asia Pacific Travel Health Society, HPTAS. This is the regional network of the travel medicine practitioner that promotes and protect the health of the traveler by advancing travel medicine and related discipline in the area of the Asia Pacific region. The same with the International Society of Travel Medicine, the Asia Pacific Travel Health Society is committed to the promotion of the healthy and safe travel in this region, work closely with the collaboration with the Society of the Travel Medicine in every country in the Asia Pacific region to promote and advocate the travel health. Next. Next slide. How about in Indonesia? Yeah, in Indonesia, we have the Travel Medicine Society, the name Indonesian Health Tourism Medical Association, with this one, like logo this one, HETMA, or in Indonesian, Perhimpunan Kedokteran Wisata Kesehatan Indonesia. The Indonesian Health Tourism Medical Association progress in the last year after the endemic area in the pandemic era to give more information and grow make the brands and every city and pandemic era as a momentum of the growing the Indonesian Health Tourism Medical Association. The goals of the Indonesian Health Tourism Medical Association to improve the quality and professionalism of the doctors in health service activities based on medical science within the field of Indonesian tourism. The focus of the Indonesian Health Tourism Medical Association to Indonesian medical service tourism, medical service tourism, Indonesian wellness, aesthetic, anti-aging, and herbal tourism. The third, Indonesian sport health tourism, and the last, Indonesian medical science health tourism. The four goals may be experience the next for Indonesian Health Tourism Medical Association. Next. The Indonesian Tourism Medical Association said that from medical service to Indonesian medical health tourism service, not only medical service, but we must focus on the health tourism service. Next slide. What the role of the Travel Medicine Society? This is the focus we must know what the role of the Travel Medicine Society. As we know, a travel, health, and safety of the travel will often depend on the practitioner level of expertise and proficiency in providing pre-travel counseling and the required of recommendation vaccination. Very important to recommend vaccination before travel. So very difference between traveler. Improved quality of practitioner in manage problem traveler by education and training. The Travel Medicine Society make the training or education for all of the practitioner in travel medicine in destination by seminars, maybe webinar or seminar, workshop, and course for every clinician and all of the practitioner. And the last may be the Travel Medicine Society can make service quality and travel medicine by certificate from Travel Medicine Society. Next slide. And the destination, what the role of the Travel Medicine Society in this picture, we can see that from pre-travel phase, how to give the pre-travel consultation and all of the problem maybe the traveler will find during travel. And in destination, there is the Travel Medicine Society must give the information from national and local health tourism, and also the tour representative local health service and destination or hospital and destination, and emergency rescue and repatriation service and also health service. Tourist experience health decision influenced by the environment, socio-cultural factor, individual lifestyle, specific risk behavior, and the others. And this, the health problem while abroad will go to the local health service or hospital, and or in transit maybe have problems in the disease, maybe emergency, can call the emergency rescue and repatriation service and health service. Next slide. As we know, the tourists or traveler are often not well informed about local healthcare situation. How about the local health situation, such as the quality of the healthcare facility and prevalent disease in the destination? This is the role of the pre-travel consultation. As we know, not maybe 30 until 40% of the traveler can consult to before travel. If the more traveler without consultation pre-travel and